Sorry about our, tested everything before we went live and everything worked fine, but then all of a sudden it didn't work fine. That's Panama. That's just the way things work sometimes. It's also me because I'm technology challenged. I'm the first to admit that. So today I want to welcome our guest, Jamie, who's living in the Las Tablas area. But before you get started, Jamie, I just want to give a quick introduction to everybody. My name's Jackie with Panama Relocation Tours. And since 2010, we've been offering all-inclusive 6-day, 7-night tours that go across the country. We also have something we call our online guide, which is like a home study course on how to move to Panama. And some people just don't have time to, do a tour, or they know exactly where they want to move, so they don't need the tour. And the online course is a way to teach people all the things they need to do and connect them with the right immigration attorneys and real estate people when they move here, so everything goes smoothly. So Jamie, thank you so much for joining us for this live stream. And I'm sorry about our little technical problems for a few minutes there.
Well, thank you for having me. And I think that's kind of a normal thing here.
Yeah, but it's kind of a normal thing. At least the electricity didn't go out. So that's good. So Jamie, when did you move to Panama?
Well, I finally came here in June of this year, June the 1st, which was almost exactly a year after my tour. I traveled back multiple times, of course, to get my paperwork and documents, but made the final move May 31st, June 1st.
Mm-hmm. So you haven't been here very long, and all of a sudden you're experiencing a whole new situation here in Panama. So when you first got here, if I remember right, didn't you stay in Panama City for a while, and then what brought you over to the Las Tablas area?
Well, I spent a little bit of time in Boquete initially. After the tour, I was on for another 5 days or so, and then my subsequent trips were in the city, more or less. I actually lined up some dental work while I was there. And then I traveled down into Azuero a couple times to look around the Las Tablas and Pedici areas.
Mm-hmm.
And then ultimately settled on Las Tablas because it was closer to the Chitre, where my HCA Panama doctor's office is, and Pedici, where the huge fish live.
Right. So for those that don't know, HCA is it's an organization that helps veterans here in Panama. They help you get set up to where you get your medications. They have clinics it's not part of the VA, but they have clinics that are throughout the country that veterans can go to get medical care, and without paying, going to a hospital or without going to a regular doctor's office. So there's a HCA in Chitre, there's one in Boquete. If you look at our website, on the upper right-hand corner, if you just type in veterans at the top, it has some information about veterans medical benefits here in Panama. And we have a link to the HCA and also Veteran Services officers that help you get set up and help you get situated. So it sounds like you've been talking to David in the Chitre area. He's really great. Yeah.
Great. He's great. And I just wanted to add, the care is free through the VA,
mm-hmm.
But it has to be service connected.
Right.
Yeah, it's got to be service connected issue. I mean, you can't just walk in for anything.
Right.
But they are great. This particular office has helped me with referrals to other doctors that I see for out of pocket for $40 or $50 a pop, which has been excellent.
Yeah, for specialists, that's a really good price.
I've had thousands of dollars worth of blood work done for about $50.
Yeah. So, one of the reasons that I invited you, and I like to, have different people all the time, but we have those people that have come on a tour or those people that bought the online guide, we have a private Facebook group, and you're a member of that private Facebook book group. And I saw you post something about an experience that you had at the hospital in Las Tablas. And I knew when you wrote that a lot of people would love to hear about that experience. So tell us about it.
Sure. Well, I'm retired, of course, and a little bit freer than I used to be. I've spent a lifetime in healthcare, in emergency rooms, and kept my arms kind of respectable for that. So if I can show you, I just decided to cut loose a little bit and get something.
Oh, you just gotta, okay.
Yeah, that has a little bit of significance for me as former Navy submariner and lifetime ocean person. The problem with it was incredibly cheap, $70 for the tap, you know. But it was bleeding significantly, so he didn't put the normal dressing on it. We just wrapped it in plastic wrap, and then I used some hyperallergenic, you know, lotion. Anyway, long story short, it got infected. I did get cellulitis, and you know, with my knowledge base, I knew what needed to be done, so I just popped in the local ER here in Las Tablas. Pretty standard, you know. They just take your name, look at your cedula, and then sit down and wait it. It was less than 10 minutes. They called me to the back. They just direct you where to stand. You stand in the line outside the doctor's office, and then he sees you in the office in between going to see his other patients. And so it's less than 10 minutes, and I was in there sitting down with him. He spoke well enough English. We communicated excellently. I told him what I knew it was, and he agreed, and what I needed, preferred. And he wrote me the prescriptions, no problem.
Mm-hmm.
And then I was free to go. There was no discharge papers. There was no aftercare instructions or follow-up.
Yeah, and they prescribe some medications for you, right? And now this is a public hospital that's in Las Tablas. You know, I've mentioned before on other live streams that there's private hospitals and public hospitals, but it's a really nice public hospital that's in Las Tablas. There's also a really big one in Chitre, and there's no monthly fee to use that hospital. You just pay as you go. If you go, you pay the doctor. Or if you don't go, there's no cost at all. So with the cellulitis, I'm sure your doctor probably prescribed some antibiotics, some other medications for you to take. Is there a pharmacy at that hospital?
There is. I took those 4 prescriptions there. One of them they didn't have. I had to buy an outside facility. But the 3 prescriptions they gave me, he looked at my cedula and he says, "Oh, you're a senior on Social Security." I said, "Well, I'm not." And he said, "You are." He gave me the medicines for free.
Yeah.
And then when I checked out at the front gate, it was my total bill was $2.
$2. So you went in with what you knew was an emergency situation. You need to get it treated quickly. Saw a doctor in less than 10 minutes, got your medications, and your total bill was $2.
$2.
Yeah.
And then the outside medicine I had to get filled was it's bicillin. It's a form of penicillin in a shot, and it was $5 at the local pharmacy.
Yeah.
My whole day was $7.
Yeah. So some people are saying over in the chat that there's a little bit of problem with the audio. I don't know if it's on my side or if it's on your side, Jamie. If somebody could let us know, is it on Jackie's side or is it on Jamie's side with the audio? But if you could get a little bit closer to the microphone on your phone or your computer, then that might help.
Sure. How about now?
So that's good. I can hear you. I can hear you just fine, but they're saying that they couldn't hear you. Oh, they said on yours, but I think they can hear you fine right now that you're a little bit closer to the microphone. Okay. So when you went to the doctor,
I'm kidding.
Yeah. Don't do that to me. So when you went to the doctor, it's pretty, I've heard from people, if you go to a doctor in the United States, you have to fill out like 10 pieces of paperwork and all kinds of different things before you can see a doctor. But here, they just want your cedula or passport. If you don't have one, just your passport number, and you just go see a doctor. There's not a bunch of paperwork to fill out. And the doctors, they've seen a little bit of everything. So, and with your medical background, then you were able to tell him what you were pretty sure it was, and then he quickly confirmed it. So you were in and out pretty quickly.
Yeah. No lab work's needed. I mean, it's pretty obvious what was going on with it. And I love the fact that everything was still paperwork, which I was in healthcare back in the days before the computer charting, and I missed the paperwork. I could write, I could type. So they did everything on paperwork, the admissions, the doctor wrote his notes on paperwork, prescriptions are all handwritten.
Right.
Yeah,
the doctor that I see sometimes in Boquete, everything is written out by hand. It's not on computer, and they just clip it together. So they have all of my history is on a bunch of papers that are stapled together, that they can look over the history, but there's not anything computerized. There's no advanced paperwork that you have to fill out. So,
Well, that's the only problem if they get burned out. I mean, then
yeah, it's a little bit of a problem, but they can just ask the person. And one of the things that I've noticed with some doctors, they don't even ask you what other medications you take to see if there's an interaction with the meds that you're taking versus what they're prescribing to you. So they may not ask you that question. It's a good idea to let them know, or let the pharmacist know, or let both of them know, just in case there's any kind of an interaction, because that's one thing that, doctors are really quick they know exactly what pills that you need, but they don't get an intake form, so they don't know what pills you're already taking, and they don't necessarily ask you that question, so you might want to let them know.
That's a good point. And they didn't ask me. He asked me a couple questions, but we didn't get in depth.
That's
basically what my allergies were. And that's a good point I would recommend to everybody. Write everything down on a list,
Yeah.
Keep a couple of copies, one in your house and one in your pocketbook or wallet.
Yeah, and keep that with you because, they could give you something that could interact with any medications that you might already be taking. It's a good idea just to have that with you anyway. Maybe someone in your car, one in your house, and one in your purse or your wallet.
Absolutely. If something terrible happens and you can't speak, it's a good thing for the EMS and the hospital people to know.
Right. So, some of the areas in Panama, they do have a public hospital where you can just go in and you can get medical care for $2, just like Jamie did. But not all areas have a public hospital. In some areas, they only have a clinic. Like in Boquete, we only have a clinic, but it's not a hospital. Volcan has a hospital. Chitri has a big hospital. Pananomi has a huge hospital. So that's one of the things you want to check out when you're considering moving to an area. Where's the closest hospital? Is it a public hospital? Is it a private hospital? If you had done the very same thing at a public hospital and gotten that, it probably would have been about $200 between the medications and the doctor visit. So you can see the huge difference between a public hospital and a private hospital. The public hospitals, that's what most Panamanians go to. They can't afford $100 a month for insurance. They can't afford, $100 for medications or $50 for doctor visits. So they go to the public hospital. And even if you need to see a specialist, like a cardiologist or urologist or something like that, at the public hospital, it's only $5 to see a specialist. So, for those of you that are concerned about moving to Panama because maybe you don't qualify for insurance because you have pre-existing conditions or because of your age, you may not be able to get insurance in Panama, just know that the public hospitals are excellent and super affordable, as Jamie had to say. So have you had any other, I know you said that your main doctor is at the HCA that's in Chitre, and then you've also saw a dentist that was in Panama. So what are some other experiences that you've had with the healthcare here in Panama?
Well, one of the things that I have covered is my back injuries from my time in the military. And so while that was covered, I got an appointment with a neurosurgeon in Hospital Breezes in Panama City. So he did some epidural steroid injections, which in the States I'd always had done in the office and then went home immediately afterwards. But there they wanted you to stay overnight. And they actually gave me IV sedation.
Wow.
So I remember the first two little needle sticks, and then I woke up in the recovery bed. That was the last time. So he did a series of about 13 injections in my back. So that's probably a good thing. All of that was covered. The downside to that was I never saw him afterwards. He never came to the room. There was no discharge again in the next morning. I had to stay overnight. And then actually sitting in my room, I had to walk out to the desk and say, when am I going to be let go? And they're saying, oh, you can leave.
Anytime. Yeah. So you're used to at least having a doctor or at least a nurse that's going to walk in and say, well, we just did this, and here's some information about your post treatment care. You need to do this and this, and we'd like to see you again in 7 days to make sure everything's okay. And these are the list of medications. That's not going to happen. Yeah, they just
at least check the feeling in my legs since you're sticking needles in my spine.
Yeah, exactly. Well, when I had COVID and I was in the hospital for 9 days in ICU, and they finally let me go. The nurse came in and the doctor came in and he said, the only way we're going to let you out is you have to be on oxygen for 24 hours. Here's the machine. Well, how do I use it? What are these settings for? And I didn't get any of those lessons at all. But I just contacted another doctor that I know that lives that gave me more instructions about it. So it was minimal instructions. So the lesson in all of that is if they're not telling you what to do, when to do it, and how to do it, start asking questions. I'm sure that they know the answers, but they're not real quick to give a lot of paperwork or give instructions. So that's a good lesson for everybody that you might, if you were hospitalized for something, they may not tell you what your post-op or your post-treatments need to be, or even to discuss with you, if it gets worse, if it starts looking like this, then come right back in here again, of course, which you would anyway.
Right, exactly. You need to be proactive in your healthcare.
Yeah, you have to be very proactive.
They have more the attitude as you will probably be okay. Bye.
Yeah. So someone asked, so in a little bit, we're going to start taking some questions, but not right now. When I do take questions, I'll ask you to put 3 question marks in front of it. But I want you to hold off on asking any questions until I finish the interview with Jamie, so we can get through all of that first. So Jamie, and then, so you've seen the doctor at Hospital Breezes, which is in Panama City, and that's where the majority of veterans go to if they need a surgery or anything more serious, and they're going to go to Hospital Breezes. And once again, we have information about that on our website at PanamaRelocationTours.com. In the upper right-hand corner, type in veteran, and it has information about Hospital Breezes, HCA, vet benefits that have to be service connected, and all those things. So just check that out for more details about it.
It's very clean, very modern, very well run.
Yeah, I remember when they opened it, it was very impressive. I saw some videos about it. It looked very impressive. I haven't been to it myself, but I've seen videos and it looked very modern. Also, the administrators and most of the doctors there speak perfect English, so that makes it a lot easier too.
And it's situated in a mall, so I rode by it 2 or 3 times before I finally figured out where it was. It looks like part of a huge mall.
Yeah. On the is it on the second floor, or does it take up both of them? I know the sign's on the second floor.
Yeah, it takes up a couple of floors.
Oh, it takes up a couple floors.
I think so, yeah.
Yep. Did they do dental work there at Hospital Breezes, or did you have dental work done elsewhere?
I had dental work done elsewhere. It's a couple of brothers who are dentists that somebody referred to me. I can't remember where. It might have been in PRT webpage, but they're Calvosas. Gianni and it starts with a P, Calvosa. But one is like endodontist, orthodontist, and the other one does the other work. So I needed 4 teeth replaced. So I went and talked to them about implants, and they told me the process and what it would cost. And so I decided to go ahead with it. It's been 3 visits now. When I finally get back to the city, I can get my permanent crowns. Mm-hmm. I'll finally have a full set of teeth again.
Okay.
That total process well, thankfully I didn't have to have any bone transplants because I had enough jaw left.
That's good.
Blessing. Yeah. And for my 4 implants, mounts, tests, and everything, it's going to be about $5,000 total.
That's really good. Yeah.
That's about the price of one.
It's usually the price of one implant in the United States is $5,000. So that's really amazing.
Yep.
Yep. That's very amazing.
A better environment there. The office staff is great. The doctors are very easygoing. They speak perfect English. It's been a good experience.
So when did you get to Las Tablas? When did you move to that area?
I came when I first came back to the country, so 1st of June.
1st of June. So you've been living in Las Tablas most of the time during the protests that have been going on.
That's
And I know that at Chitre, Davicia, Chitre, La Villa, that the roads have been blocked quite a bit. Has that impacted, or what's been your experience living in Las Tablas during these protests?
Initially, it didn't have a huge impact, but now the stores are, of course, out of certain vegetables. It's mostly root vegetables, potatoes, yucca, those types of things, and some apples. So I went in the other day in one of the local grocery stores, and the whole produce counter was full of red and green apples.
Mm-hmm.
No tomatoes, no carrots, no lettuce, celery, none of that. No peppers of any kind.
Yeah.
Day-to-day life in the city, in the town, is pretty much normal.
So gasoline, propane, are those available?
They are available.
Yeah.
I haven't seen the price gouging that some other people had been seeing.
That's good.
Restaurants are pretty much all open and running business as normal, so they're getting supplies. But just in the last few days, because it's also, the month of holidays, so there's been a lot of places closed just for the holidays. The problem with me is my doctor is in Chitre, so I've not been able to get up there. And that's also where we get our mail. If you're a member of HCA Panama as a veteran, they will ship your envelope mail into you for free, and then you pay for packages, just like in the other mail forwarding companies. So I have medicines waiting on me, mail waiting on me.
Yeah.
And get there.
Hopefully it'll clear up pretty soon. I know the government sent out a notice that the national police were going to get involved in clearing up some of these protest areas, but I haven't seen it happening just yet. So hopefully it'll happen soon, and then things will open up a little bit more.
Well, I don't know anything about it other than what I hear secondhand, but I hope it clears up, because I think and I haven't been long enough to make this a informed really thought, but I think some of the citizens are maybe done with it too.
Yeah, they definitely are.
Children back in school, those kinds of things.
Yeah, they want to get their kids back in school and get just everything moving where it needs to go. Get the green peppers and the red peppers and the lettuce and tomatoes where they need to go. And
right.
there's still a shortage of gasoline and propane in the Boquete area, but they're bringing some in from Costa Rica because it's not able to get through from Panama City. So at least the government's jumping in and trying to do things to help and make it a little bit better. So that's good.
Yeah, I saw the one post where the guy was paying $7 a gallon. Ooh.
Yeah.
$70 for 10 gallons.
Yeah. You have to be pretty desperate to do that. Yep. So because you're covered, because you're retired military and you're covered with TRICARE or VA or things like that through the HCA, do you plan to get any other kind of health insurance, or are you just going to rely on the public hospitals and the HCA? That's probably all you really need.
That's all I'm going to use personally. I am also covered under Medicare Advantage.
Right.
So if I have a true emergency and let's say I want to go to a higher level of care hospital, then I know I'm going to be paying out of pocket for some of that. And I think the way that works is you pay it out of pocket and then submit the paperwork for reimbursement.
Right. And you can put it on a credit card and make the minimum payments until you get reimbursed. So you're really not out of pocket very much with a Medicare Advantage plan. So yeah, so a lot of people, they think, oh, they have to get insurance, but insurance is really good to get whenever you qualify for it, but sometimes you don't because of pre-existing conditions or age. But just to know that to have peace of mind to know that through the public hospitals, you can still get really good medical care. And if you're a U.S. citizen and you have a Medicare Advantage plan, a lot of people, they're going to keep that Medicare Advantage plan just in case you want to go back to the U.S. for some kind of treatment, or you decide to move back, whatever, you keep it, but it's going to cover any medical emergencies that you might have here in Panama.
Yeah, you don't want to drop it and then have to need it and go back to the States, and you have to wait until qualification period again.
Right. Well, plus you pay a penalty if you drop it. So you don't want to get into that. It's better not to.
Yep.
So is it okay if I open it up for some questions from our audience?
I'd be happy to answer.
I have a few questions for you. Cynthia says, so no insurance company in Panama will insure an expat with a pre-existing condition like a heart stent. That's correct, Cynthia. You can't get insurance in Panama with a pre-existing condition like a heart stent. However, if you're a U.S. citizen and you have a Medicare Advantage plan, then it's going to cover a medical emergency. There's also some of the travel insurance companies will do a 1-year travel insurance policy, and they'll also cover medical emergencies, but not just routine doctor visits and things like that. Another is, if anybody has a question for Jamie, if you would please put 3 question marks in front of your question, and then I will pop it up here on the screen.
I would also say the Advantage plan, since it covers emergencies and urgent care visits,
right?
Then just about anything that's going on with you, you could make it an urgent care visit.
Exactly. Yeah, exactly. For example, the visit you just had, but it's surely not worth filing a claim for $2 doctor visit. No, not worth it.
Nope.
So I've had, Mark says, I've had numerous recent doctor hospital visits here. I'm assuming you mean in Panama. More and more they communicate via computer portal, and now I see test results, etc. Is this something becoming available in Panama? So the question is, some doctors will do like a Zoom meeting with you if you can't do a face-to-face. But test results are something that is usually not sent to your doctor. They're going to send it to you. Or you have to go to the lab and pick it up. Some labs will email you the results, and then you can share it with your doctor. But even if the doctor ordered certain lab results, the lab results are not shared with the doctor. They're sent to you. And then you can take it from there.
And I'll add to, if you don't mind, that in Panama City, I've been to 3 different hospitals. I had an MRI done at I can't remember that one, but I had an MRI done for $60. I had a bone scan done at Punta Patilla.
Punta Pacifica Salud, maybe.
Salud was the MRI, was $60. And then Padilla, whatever.
Hospital Patilla.
Hospital Patilla. I had a bone scan done there, and it was a special they had for $60.
Wow.
And that was electronic. You could go in, establish an account, and get your results.
Right.
So there, we're all using electronic data.
Yeah. So, some, especially in Panama City, a lot of those hospitals may be a little bit more sophisticated than some hospitals in some other areas. But even a lot of the public hospitals, especially the newer public hospitals, they have the latest and greatest equipment to take care of anything that you're going to need, like MRI machines and CAT scan machines and all those kind of things. So Monique wants to know, can Jamie tell us where the dental clinic is that he used? I missed that.
Sure, absolutely. It's the Calvosa brothers, but it's called Clinica Galleria Balboa. So it's a dental office in Galleria Balboa on Balboa Avenue in downtown Panama City.
Okay. And Rich says, labs, what would be the level of MD consultation in a private hospital versus a public hospital? It'd be the same. Yeah, many of the doctors that work at a public hospital, they also work at a private hospital, or they have their own private clinic. So you're not going to get, an inferior doctor at a public hospital than you would at a private hospital. It's just that at a public hospital, you may have to wait a little bit longer to see a doctor. But Jamie had to wait 10 whole minutes to see a doctor, so it's not too bad. And they assess it. They assess the urgency of the situation. And if it's an urgent situation, they're going to get you in there really, really fast. Like if you're having a heart attack versus somebody that has a sinus infection, that's not quite as urgent. So they're just going to assess the situation. You're going to see a doctor, not necessarily first come, first serve, but who's the worst that needs to see a doctor the fastest.
That's the theory behind triage.
That's the theory.
Right.
And, whether you go to a hospital in Panama or whether you go to a hospital in any country, they're going to see urgent situation first. So Lewis says, is it correct that in Boquete area, you should have $300 in cash for ambulance transport? No, that's not true. Actually, if you go to the public clinic in Boquete and you need an ambulance to go to the hospital, it doesn't cost anything. It's absolutely free. There are some private ambulance services that are available in Boquete. They do take credit cards or cash. But if you just go to the public clinic that's in Boquete or in Volcan or in any of the others, for example, if Jamie went to the clinic in Las Tablas and they determined that his situation was so severe that he had to be transported by ambulance to the hospital in Chitre, and try to get through the protest lines. But with the ambulance lights, they would probably let you in. That ambulance would have been free. So, any of the ambulances from a public hospital doesn't cost anything. So the $300 is a myth that a lot of people have passed around. It's only if it's a private one. So Chris says, Happy Veterans Day. I'm a veteran also. I'm not familiar with HCA. Where is it at? So once again, to get more information about veterans medical care and HCA, if you'll go to the Panama Relocation Tours website and type in veterans at the very top, it has a link to the HCA website, information about veteran service officers, information about medical care that's available and the benefits that are available. So that's where you can get more information.
And happy Veterans Day, Chris, to you and all the other veterans who are listening today and might be listening later.
Okay. Did they have treatment for vets with PTSD and alcohol problems with 100% VA benefits in Panama City? This is for my son. He's moving to Panama in July. So I'm sure they probably do, especially if he's 100%, if he's been declared 100% disabled, and they're going to be able to take care of anything, including PTSD or alcohol problems. But that's my guess. I can't really answer for the HCA or for the hospital breezes. The best thing to do is to go to that link that I told you about, veterans, and you can contact the veteran service officers, and they can give you a lot more information about what kind of care is available, what medications are available, and all of those things. I don't want to say they can or they can't do something. It's better to talk directly with a veteran service officer, and they'll know the answers to all of your questions and also help you get set up with the hospital. Make sure that you are registered with all the different things that you need to do to get foreign medical care through TRICARE, VA, or any of those other things. They know what you need to do.
That's right. And if he has not already filed a claim, which is advisable if he hasn't, to get that done, but they can also help you with any claims, supplementals, or higher level reviews.
Right. So which Medicare Advantage plan do you have?
Mine's through Aetna, using my daughter's location in California.
Mm-hmm. And I have one through AARP, United Healthcare. But it doesn't really matter what I have or what he has. What matters is what would you qualify for based on the zip code that you're using. We did a live stream about a month ago with Jeff. If you go to our YouTube channel and click on live, then you'll see a whole interview that I did about Medicare Advantage. You can contact Jeff and get a free consultation, and he'll tell you which Medicare Advantage plans are available in your area, because what I have available where I live and what Jamie has available where he lives may not be available where you live. So talk to Jeff and he can get you all set up with that.
Yep, Jeff helped me.
Yep. He helped you too? Yeah, he helped me with mine.
I had Humana when I was living in North Carolina right before the move, and I called them, asked them about the Advantage plan. And they're like, "It might cover you. We don't know for sure."
Yeah, I've heard that Humana's not a very good one. And especially they are resistant to pay any claims. So you don't want to be in a situation where the claims don't get paid. So David wants to know, are there public and private hospitals in David? Yes, there are. There's several private hospitals and one great big public hospital in David. Now, some people go to the Johns Hopkins Hospital to get seen. So the Johns Hopkins affiliated hospital is called Pacifica Salud. And Jamie had talked about that he got some treatments that were done there at Pacifica Salud. Some people go there. It's convenient if you live in Panama City. But if you live 8 hours away from Panama City like I do, then I'm not going to go all the way to Pacifica Salud. I'm just going to go to a hospital that's right down the street from where I live.
I will say that their MRI machine, which is my only experience there, is a wide bore. So if you're claustrophobic, you're absolutely fine in that machine.
Okay. At 70, what are my best insurance options? So if you go to the Panama Relocation Tour website and you just type in the search feature, health insurance options, we have a whole article about it, and I have links to brochures for several different insurance options. And the answer is really, it depends. If you're going to live in Panama City, it would probably be Hospital Santa Fe. If you're going to live in other places in Panama, then it might be the Family Medical Plan. If you travel a lot, you might want to get an international health insurance plan. But if you go to that article on our website, just type in the search feature, health insurance options, then it has links to all the different brochures, and you can get an evaluation of, what's available and what it's going to cost. Monique wants to know, what do you like most about living in Las Tablas? Good question.
Yeah, I like it because it's more traditional. It's rural. It's slow paced. It's easy going. You don't have the crowds. You don't have certain times of the year. Most of the time, you don't have a lot of noise, except roosters crowing, if that bothers you.
Or some dogs barking.
Yeah. The downside is there's not a lot of traditional restaurants that you might be used to. It's mostly fondas. At the big hotel there, Presidente, they do have a nice dining room and a nice menu and good food. But most everything else is going to be pizza, and they have some good pizza houses. Yeah. Like I said, the people are pretty laid back. They're not overly warm and friendly, but they're not abrasive or ugly either. Drivers here are the same as anywhere else in Panama. It's just less of them here.
Yeah. So Jamie mentioned that it's mostly fondas. And for those of you that don't know what a fonda is a typical little Panamanian restaurant. A lot of times if they cook meat, it might be cooked on a grill outside. And it's where you can get a whole plate of food that'll have a meat, maybe a salad, some potato salad, and almost always some kind of beans like lentils or something, and rice and a plantain for about $5. So it's really super affordable, super fresh. And those are very popular all over Panama, but especially in the Las Tablas area.
We have quite a few from here that's about $3.50. It's comida completa, which is whatever meat you choose, and then they put the rice and beans and a little tiny bit of salad on it, and chiche, which is the fresh juice, for $3.75. Not bad.
Right. Edward says, does an expat need to bring medical records with them into Panama? It would absolutely be advised for you to bring your medical records. If you could put it on a CD, then most doctors could look at it that way, or you just have them printed out, then you could bring it that way. But if you have pre-existing medical conditions, it's a good idea to bring your medical records. Also, if you have pre-existing conditions, whenever you first come here, even if you're not sick, even if you don't have a medical need right away, go ahead and establish a relationship with a doctor in your area. and show them your records. And you might want to visit with a couple of different doctors till you find one that you feel comfortable with, that you feel you can communicate with, that you can understand their English. Most of them speak English very well. Some of them only speak English a little bit. So visit with several different doctors to find the one that you feel comfortable with. Then you've already established a relationship with that doctor. And, most medications here, you don't need a prescription to get them refilled, but some medications you do. So if you have that relationship with your doctor, then they can tell you if your medications are available. Some of the medications you take might not be available in Panama, and they may have a substitute, but you'll have to discuss with them, the pros and cons and advantages or disadvantages of taking the substitute as opposed to what you've been taking for a long time already. It may be better to get medications shipped in from like Amazon Pharmacy instead, if you want to take the very same medication that may not be available here. And also know that just because you go to one pharmacy and they say, well, we don't have that, and you go to another pharmacy and they say, we don't have that. If you go to the pharmacy at a hospital, they might have it there. There's also a lady in Panama City named Julie that has a company called simplifypanama.com. And if you contact Julie and say, I need, this medication, this medication, this medication, and, they don't have it in Las Tablas. Do they have it in Panama City? She can call several different pharmacies in Panama City, find that medication for you, and then ship it to you in Las Tablas when the protests aren't going on.
Yeah, I think doctors here are willing to write your prescriptions too, pretty easily. And for me, when I took the prescription, I've taken several in. They always give you the medicine and give you the prescription back.
Yeah, they just give it back.
You can use it again.
You can use it again, yeah. And, they're not going to look at it and say, oh, this was written 6 months ago. Right. We can't do that. They don't care. It doesn't matter. So Edward says, in the States, I found medical facilities reluctant to hand out digital records, but will send records. Would that process work the same? Well, tell them that you are moving out of the country, and then that might make it possible for them more likely to send the records to give you a copy of your very own medical records. If not, then you're going to have to find out who the doctor is going to be that you're working with and then get it that way.
I would say that it's federal law that every patient is entitled to a copy of their medical records.
Okay.
And if you still refuse, maybe get your local congressman involved.
Yeah, there you go.
And they'll call them and say, hey, what's the deal?
Yep. Good idea. I didn't know that it was required by law. It's your medical records. You should have a right to have a copy of your own medical records.
And they would be in violation if they refuse to give them to you.
Okay. And another question. How does the vet who moves to Boquete define the home zip code? So if you're talking about for a Medicare Advantage plan, for Medicare Advantage plan, you have to have an address in the United States that you use. So it could be your family member's zip code that you're using. Is Las Tablas as hot and humid as Panama City?
No, more so.
Yeah, more so. The big advantage of the Las Tablas area and that whole Azura Peninsula area is it gets significantly less rain than other areas in Panama, than Panama City. For example, I have a new article coming out that talks about the amount of rainfall in each one of the different most popular areas, amount of sunshine, and things like that. And Las Tablas has the least amount of rain and the most amount of sunshine out of all the places that are in Panama City. So that's a big, big plus.
Yep, that's true.
Yeah. In Boquete, especially October and November, it gets pretty old by the end of November to have gray skies and raining every single day. And that's when a lot of people, they would just go to the beach and hang out for a little while and get back into some sunshine, or go to Las Tablas for a little while. So what kind of activities do you do, Jamie, in Las Tablas? Do you go fishing or do any of those kind of things? I know there's a lot of
Yep.
You probably know Wally and some other people. They love to go fishing almost every day.
Oh yeah, and I did too for a while, but the pulling up some of those monster fish did some damage to my back again, so I have to have surgery now. So I've had to lay off the fishing. I do own a four-wheel drive, and there are many accesses to the beaches here.
Mm-hmm.
And even though they're not the, brilliant white, blue water Caribbean type beaches, it's really easy access, and they're almost always abandoned. There's nobody ever out there. So I have the whole beach to myself a lot of times.
Yeah.
And I do like to travel around in the woods. I take different roads just to explore them until it gets too rough on the car and then turn around.
So from Las Tablas, further south is Pedicey and then Playa Venal. Have there been any roadblocks going further south, or have you been able to travel down there?
Well, I didn't travel during this time, these last 2 weeks, but I understood that there was initially, but not anymore.
Not anymore.
Yeah, they pretty much keep everything blocked at La Villa, outside of Chitre. So not many people are going that far except locals here, and I think they don't care.
Right, they don't care. So Gail wants to know if you speak Spanish.
Sí, un poco.
Yep. A little bit. Little by little. Yeah, whenever you're just around it and you hear it every day and you start using a little bit and a little bit and a little bit more, then you just pick it up.
But I'm an old dog with some memory issues, so it's a little harder for me, but it's coming. The hardest part for me is to understand when somebody's speaking to me in their native tongue. That's when I'm like, can you slow down just a little bit?
Yeah, they start going really, really fast, so you have to definitely slow it down.
But there's almost no English-speaking people here that I've run into, so I do pretty well. I get along by myself.
Yeah, there's some English-speaking people, but not a lot.
No.
So Vaughn, I see that you mentioned that a particular freedom insurance that you have that doesn't cover you in Panama. I would suggest that you go and watch the live stream that I did about Medicare Advantage, and then set up a free consultation with Jeff. And he can tell you which Medicare Advantage plan that you can get that will cover you for urgent care and emergencies here in Panama. If the one you have doesn't cover you, don't worry, there's other options, plenty of other options, and Jeff can help you with that. So, since we're talking about health, are there any gyms or workout places that are in the Las Tablas area?
There is a couple of small ones. One of them is never open, so I'm not sure it's still in business. And then there's another little one on a back road going into Las Tablas. It's very small. It's not a lot of equipment. And it doesn't really look like it's open to the public. If I was to go in with my gym shorts on, I don't know if I'd be welcome or not. It's really tight.
Yeah.
There is a community pool that you're welcome to go to. All they ask is that you see a doctor and get a clean bill of health, a certificate that says, as far as that doctor is concerned, you have no communicable diseases or mental health problems.
Right, things like that. And you need that just to get a visa in Panama.
And it's a large pool. It's an Olympic-sized pool. It's open from Tuesday through Friday mornings.
Uh-huh.
It's free to use. You just have to, and once you submit that that doctor's note and your cedula, then they already have you in the system and you're good to go.
Right. So Denise wants to, we're just going to take this one more question. Denise wants to know if you have a rental property and, about what are you paying per month and what's included.
I do rent this house. It's a big house. It's a 3-bedroom, 2-bath. It was furnished. There's air conditioners in 2 of the bedrooms, not the 3rd and not the living room. It's tall ceilings. I don't know if you can see them, but
yeah.
So it would be probably expensive to keep the whole house cool. The nice thing about it is the breeze through. So during the day, we can open up the doors and the breeze blows through with the help of fans. Even if it's 95 or 100 degrees outside, it's, upper 70s and 80 at the most in here. The master bedroom is fairly large and has an ensuite bathroom, and then there's a second bathroom for the other 2 and for the guests. I pay $450 a month. Huge yard, completely fenced in. It's in a section of Guadalajara that's pretty quiet. You know, there's no businesses up here. Not a lot of drive-through traffic. It's up on the hill, so I get a good breeze. It's actually called the Mirador de Bella Vista, which is,
And you're not very far from the beach. They're right. Like maybe 10 minutes. Yeah.
Playa Bella Vista is less than 2 kilometers from my house, so it takes me about 5 minutes to drive there.
Yeah.
And then the other nice beaches like Ubarito and some of the other ones, I can't remember the names. So yeah, 10, 15-minute away.
Yeah. So good. So yeah, good price. So, and it came furnished. It's $450 a month and it came furnished. Does that include your utilities or do you have to pay some of your utilities?
No, you pay your utilities. They pay the water, which I don't know, maybe it's $25 a year, and that includes trash.
Yeah.
The gas is up to the renter, but I've been here 5 months now, and this tank of gas has not run out.
Yeah.
I'll use it for cooking. I have a suicide shower in the main bathroom. No, that's not advised, but I like a warm shower.
Well, and you know, when you live in a place where it might be 85 degrees outside, a cool shower actually feels good.
It is. And I alter between them. In the mornings, I take a warm shower, but I installed it, so I trust it.
Yeah.
And I bought one of the better models, not the cheapo.
Right.
And then my lights, when I first came in, I think the first month was $80. Then it dropped to $70 and $60. And last month it was $50.
Right.
A little $50.
So just
and I run my bedroom almost all the time.
Yeah, it's very common whenever you live in an area where the weather's warmer, where you're going to need an air conditioner. It's very common that the electricity is not included because some people are going to have an air conditioner in their house and they're never going to use it. But some people are going to live in the house and they're going to keep their air conditioner on 24/7. In all the rooms, even if they're not in it, just because that's what some people do. And the landlord doesn't want to get stuck with an $80 or $100 electric bill. So it's very common in the warmer areas that electricity is not included. But there's all kinds of things you can do to keep that bill low. Most of the houses in Panama have what's called a split, which means it's just an air conditioning system in each room where there is an air conditioner. So you just turn it off. If you're not going to be in the room, you turn it off, and you only turn it on when you're going to be in there. It doesn't take long for it to cool everything off. But there's no need in having there's no need in having the air conditioner on when you're not in the room. Sorry, I got a tickle. And I forgot to bring some water with me. So, Jamie, I want to thank you so much for sharing your information.
It was a pleasure. Glad you had me.
Yeah. And thank you, everybody, for joining us for this live stream. I hope you enjoyed it and enjoy the rest of your weekend. Goodbye.
Bye now.